Deanna and her mom had concerns about cancer, so we set up an appointment with a surgical breast specialist, our friend, Dr. Christy Funk.
So you're here all the way from North Carolina. Talk to me about why.
They just keep growing. And now my new problem is I've been having shooting pain to my nipple.
Have you been noticing any lumps?
I haven't really been checking. I should be checking because my mom, she had breast cancer and she had a mastectomy.
Mom, how old were you with your breast cancer?
It's been 10 years now since I'm really concerned since I had breast cancer that I'm passing it down to my daughter.
Right, well, I'm gonna do a good exam on Deanna today and we'll make sure that there's no sign of cancer in there. Both arms straight up overhead. Perfect, and now on your hips. I'm done with the manual exam. I'm gonna do an ultrasound now. What we'll do next, if you want, we can do the weight of your breast. This will help us make some plans. 4,460 grams equals 9.8 pounds. Having breasts this size is something called juvenile gigantomastia. This is not something that is due to anything you did or you could have done differently to prevent. This is just something that's happened. I have great news. There's absolutely no sign of breast cancer in either breast.
Good news, good news, good news.
Deanna and her mother, Teresa, now join us. You know, Deanna, was at least that some good news for you?
Yes, I was really relieved and kind of excited that, you know, I can kind of go through life not knowing right now that I'm okay.
I saw your mom crying as we were watching the tape, and I know it was hard.
She kind of went through it herself, which kind of was big back then. Maybe she was like a double D when she was my age.
What about it caused you to cry in the tape piece and cry watching it?
Thinking about her, what she's going through now and what I went through as a child, you know what I mean? You just don't feel good. Yes, it is.
And I think what you're hitting on, which is so important, is that it's the spirit and the psychological and emotional toll that can go along with the physical condition here. And when you talk about being a teenager, which, Deanna, we know is hard enough as it is, something that caused you to stop playing a sport, something that caused you to retreat to your home and miss out on all of the things that every teenager deserves. I think mother to mother is, I know why you were crying.
Because not seeing her want to go to the prom or anything, dances.
And I know you came on the show because you were seeking answers. Number one, just to make sure that you were cancer-free, but also to see if there was a solution. And we actually do have a surprise for you. I want you to check out the special messages from board-certified plastic surgeon Dr. Stuart Collins, who is also from Raleigh, North Carolina.
Hey Deanna, my name is Dr. Stuart Collins, and I'm a board-certified plastic surgeon right here in Raleigh, North Carolina. I was able to look at your photos and your bio, and you do suffer from a remarkable case of gigantomastia. I can only imagine how your condition encumbers both your lifestyle and your self-esteem. That's why I'm excited to invite you here to the office, and if you're a surgical candidate, offer to perform your surgery for free. I look forward to meeting you and seeing you through this journey.
And Deanna, because we also really want to help you with the emotional and mental transition here, we're offering you 10 sessions of therapy, compliments of Doctor on Demand. Doctor on Demand is an app that allows you to see and speak with a medical professional via FaceTime on your phone, and hopefully this is really going to help you with the healing process from the inside out.
Before we say goodbye, how are you feeling about all this?
A little overwhelmed.
We are rooting for you. We're wishing you all the best, Deanna. Thank you both for coming on. We'll be right back.